What would you say if I asked you, how do you think this beautiful woman feels in this picture? I would say she looks and feels happy, thrilled to be alive, right? Well, how would you feel if I told you this is how she really feels? This is what is going on in her head all the time. Good evening. My name is Cindy Gomez, and I'm here to raise awareness about the importance of the correlation that exists between mental health and eating disorders. First, we need to understand that an eating disorder is a mental illness. It is not a choice, a lifestyle, or a trend. It is a disease that has to be treated by a professional. It is known that anorexia, bulimia, and binge eating are very serious and life-threatening problems that require professional help. According to Oxford Clinical Psychology, over 13 million women binge eat, over 10 million battle anorexia or bulimia, and over 1 million men battle anorexia and bulimia. So as you can see, an eating disorder can affect not only women, but men too. The cause of a development of an eating disorder is usually caused by multi-factors that include the media, society, family, and other psychological factors. So exactly what are the causes of an eating disorder? Although eating disorders all have food and weight issues in common, most experts now believe that eating disorders are caused by people attempting to cope with overwhelming feelings and painful emotions by controlling their food intake. Unfortunately, this will eventually damage a person's psychological and emotional health. So some factors that may be involved in developing an eating disorder can include genetics, the environment, peer pressure from society, and emotional health like tendencies to perfectionism or impulsive behavior. It is also very important that you know that co-occurring disorders exist. And this is when a person has two or more mental or substance abuse disorders at the same time. This is really important because sometimes an eating disorder can be misdiagnosed when a person already has depression, anxiety, or maybe he or she is an alcoholic. And it is really important to have in mind that a person can have two or more mental health disorders and that they have to receive the proper treatment for all the mental disorders at the same time. A person with an eating disorder will have the best recovery outcome if they receive an early diagnosis. If an eating disorder is believed to be an issue, a doctor will usually perform as a physical examination. In addition, a mental health professional will conduct a psychological evaluation. This is very important. And they will also ask questions about eating habits, behaviors, and beliefs. There are also symptoms that must meet the criteria of the Diagnostic and Statistical Manual of Mental Disorders. Some eating disorders treatments include a complete lifestyle change. This is really important. Psychological and psychiatric help. And the most important one is to have a support system. There are a lot of emotions that need to mend with treating an eating disorder. And it really helps if there's a person or a loved one behind you to help you. Last but not least, an eating disorder is not a choice, but recovery definitely is. Recovery is possible with advice and love and support. This is really, really important. So please, if you need more information about the topic, or if you or a loved one are suffering from an eating disorder, visit rethinkmental.org. Thank you for your time and have a great evening.